Hello friends, I am Dr. Deepak Ugra. Today I am here to separate out the facts from the myths about the cold and cough, especially in children. It's a common myth that we all have, many of us have, that when a child is unwell, we shouldn't be feeding the child. In fact, whenever a child is unwell, the basic metabolic rate of the baby is high. The baby demands are more, and more calories are also required to recover faster. And we shouldn't be restricting the food, rather we should be giving food and the fluid. Remember one more thing, if the baby has fever, better we hydrate the child, more we have a control on the fever. So it's important to continue feeding the child while he's unwell. It is also important to keep giving small quantities of warm liquid. You can give soup, you can give warm water. If the baby doesn't like plain water, you can even mix a bit of honey into it. It gives a soothing layer to the throat, because whenever a child has cold and cough, and if nose is blocked, he's breathing through mouth, his throat gets dry, and dryness of throat is one of the strongest triggers for the cough. So by giving warm liquids, you have a better control on the cough. It's a common myth that many of us believe that we shouldn't be giving milk to a child who is having cold and cough. In fact, if the child has allergy to the milk, more than cough and cold, he would have the gastrointestinal symptoms, in other words, something like vomiting, abdominal cramp, diarrhea, than having cold and cough. Small children, whenever they are unwell, usually shift to liquid diet, and the best liquid available to them is mother's milk in the first year and later other milk. So if the baby is taking milk, in fact, we are lucky that we have taken care of hydration of the child, and also milk has calories, so that provides calories to the child. There is no such thing that we shouldn't be giving fruits during the time when the child has cold and cough. Yes, if a child is allergic to a particular fruit, let's talk about banana. Many people feel that when the child has cold and cough, we shouldn't be giving banana. It's not like that. Yes, I agree. If a mother has observed that whenever she has given banana to her child and the child starts coughing, that particular child should not be giving banana. But others who do not cough usually when you give banana can be given banana even when the child has cough. The same stands true with all the fruit. Yes, citrus fruits like sweet lemon orange can be avoided during an episode of cold and cough. When we talk about over-the-counter drugs, we should be very, very clear about what we are talking about. As far as small children are concerned, if we do not understand what a particular cough syrup has, it may be more dangerous for my child or harmful for my child rather than having any beneficial effect. For example, in a small baby, a cough is a protective reflex. We must not suppress it. A child is trying to clear out the chest by coughing. If I suppress by giving a cough suppress, I am causing the child more harm. For few hours, a child may feel better, but later on the chest congestion is going to increase and a child will land up in a very bad condition at a hospital. If you want to use any OTC, any over-the-counter drug, I would suggest to use only the saline drop, which keeps the nose clean. One of the most common factor in children for cough who are suffering with flu or viral infection or allergy is dryness of the throat. So why? Because when the nose is blocked, the children are breathing from their mouth, so the throat becomes dry and that triggers cough. If by putting saline drops in the nose, I am able to keep nose open, the child may breathe through the nose and will not have that much of dry throat, will help. If you ask me which is the best cough syrup available to all of us, I would suggest the most important and the most effective is lukewarm water. If the child doesn't like the taste of water, lukewarm water, you can mix a bit of honey into it to make it more palatable and give a small sip very often. Let us understand about steam inhalation and cold and cough in children. I say that it might work in adults, but it doesn't work that well in children. We have to first understand and accept that it's very difficult for the parents to differentiate whether the child has allergic cough or infectious cough. As far as allergy goes, if you give steam of plain water, it may trigger allergy in a given child and may trigger cough. So that is harmful for the child. If it is only a upper respiratory involvement, which again I would say it's very difficult for the parents to identify at home, it might help, though there is no such evidence in favor of the same. So in short, what I would recommend is a child who has cold and cough, rest him. If possible, voice rest. It may not work every time. Give plenty of liquids. Give warm liquids to have a soothing effect on throat. Put saline drops to keep the nose clean. If any further medication is required, your child is not doing well, it's better to consult a doctor rather than giving a medicine yourself. Rubbing Vicks on the chest does not help the child in cold and or cough. In fact, if you see the Vicks Vapor Rub, it has a very strong smell, and that strong smell can at times trigger the cough, especially amongst the children who have allergic cough. So I would not recommend putting Vicks on children who have cold and cough. It's a myth that any kind of fever or any kind of cold and cough needs antibiotic. We need to understand that most of the cold and cough seasonal are viral. Most of these children, especially below 5 years of age, have allergic cough also, and antibiotics have no role in allergy nor in any viral infection. In fact, you give an antibiotic to these children, the antibiotic is not going to help, and the child may land up having some diarrhea, vomiting related to the side effect of the antibiotic. As far as multivitamins are concerned, let me first clear one doubt in everybody's mind. Multivitamin means jack of all, master of none. So you have multivitamin which has iron, which has calcium, which has zinc, and many more. Now iron does not allow calcium to be absorbed, the calcium does not allow zinc to be absorbed, and the zinc does not allow iron to be absorbed. So at the end of the day, nothing is getting absorbed. You are just feeling that you're giving something for your satisfaction, you can give multivitamin. But yes, there is a very specific role of some of these things. The first and foremost is vitamin D, and vitamin D deficiency is very common among children. If the vitamin D is low, that child can have recurrent cold and cough, or may have even persistent cold and cough. It is important that if a child is not responding to the medicines and coming down with the cold and cough very often, to look at the vitamin D status, and if low, supplement it with the therapeutic dose and not with the daily maintenance dose. Zinc also plays a very important role in immunity, so also the iron. So yes, if a child has a specific deficiency, correct that deficiency, that would help in having a better control in cold and cough, but multivitamin per se have no role. Vaccines are excellent as far as health is concerned, prevention of infections is concerned. We must understand every vaccine and its role. So flu vaccine, which is available to us in the market, prevent 3 or 4 different types of flu, but not all flu. So if you have an expectation from the vaccine that your child will never have cold and cough flu, then that's not a correct expectation. I would suggest that the flu vaccine should be given to all those children who have recurrent respiratory problems, upper or lower, children who have any other underlying disease, or during an epidemic of the flu. For example, in the state of Maharashtra for last many years, we are observing a lot of cases of swine flu. This flu vaccine also protects against swine flu. So it's better if we give to the children at this time. See, once a child has cold and cough, he is infectious till his symptoms are there. Because how does the respiratory infection goes from one person to the other person? It's through droplet infection. So whenever a child who has cold and cough, he sneezes, or his nasal secretions are coming out, or he's coughing, he's leaving the droplet in the air. Whoever comes in contact with this droplet will probably get the same infection. If my child has cold and cough, I shouldn't be sending the child to the school especially, and even if suppose there is a celebration, some other bachchu's birthday party, it's better to avoid sending your child to attend such a party. He would land up giving it to all others. So let us understand the need to see a doctor in a child who is having cold and cough. So there are 2 situations. 1, a child who has sudden onset of cough and is very unwell. 2, a child who keeps getting cold and cough for last 6 months, 1 year, 3 months. So let's separate it out. The child who has acute cold and cough, any child whose sleep is disturbed, whose feed is disturbed, need to see the doctor immediately. Any child who is breathing very fast need to see a doctor. Any child who has very high grade fever along with fast breathing need to see a doctor. So this is about the acute onset or short duration illness. Now, children who are falling ill very often, having cold and cough every now and then, once in a month you are going to a pediatrician cold and cough, in any case need to see a doctor. It is not the severity of the disease, but it is very difficult to understand the underlying cause which is causing the recurrences. It needs investigations which only a doctor can plan. Recurrent cold and cough is a common problem in our day-to-day practice. Many children keep getting cold and cough every month. We have discussed till now what is to be done for cold and cough. Now let's discuss what are the precautions or what are the don'ts during the cold and cough. So recurrent cough very often is allergic. So we need to see what are the things that we need to avoid during the child who is having cold and cough, and even in the period in between the episodes of cold and cough. The first and the foremost, the most important trigger is smoke. People say that I don't smoke at home, I smoke outside. It doesn't matter, because once you smoke a cigarette, you keep exhaling nicotine for many hours after that. Your clothes are smelling, your car is smelling, the house is smelling. All dust is not good for the child. When we talk about smoke, it's not only the cigarette smoke. We need to be careful about using the tortoise coil as a mosquito repellent. In the kitchen, when you're frying something, the child should not be going to the kitchen. Agarbatti in puja, dhoop in puja, all those things that produce smoke are bad for children. The second most important thing is strong smell. So when I say strong smell, it is newly painted house, newly painted furniture, nail polish remover, commonly used acetone, then petrol, all deodes, they have particulate matter. Some of the perfumes, not all perfumes, are strong smell. We should avoid exposure to these things. Third is artificial flavors. So all junk food is absolutely out. So you have a cake, pastry, especially the cream, you have colored chocolates, candies, all that is out. Cooling of the windpipe is one of the strongest aggravating factor for cold and cough, and therefore all ice cream and cold drink are out. So these are the common don'ts that we should be taking care of in any child who has a recurrent cold and cough. I hope I have answered most of your questions. I hope I have cleared most of your doubts. If in case you have any other questions, you are most welcome. You can write in the comments and we'll try to clear them out. Thank you so much.